Hey, Courtney.
Hi, so nice to see you. How are you?
Yeah, good. And you?
Good. Yeah, days are starting to get longer, sun's coming out.
That's what I hear. Yeah. Everyone's spirits are lifting.
Yes, yes. How about you?
Yeah. Same here. Same here. Yeah. And, I've had vaccines. So I was in a vaccine trial, actually. So
Yes, it
fortunately,
does.
it was the active vaccine.
Oh, that's good. Yeah, we were lucky we got sent quite a lot of vaccine up north, so a lot of us have been vaccinated as well, and it
Great.
definitely does make you feel more sort of secure in the world, doesn't it?
Yeah, absolutely. Yeah.
Yeah. So we'll, cheer on our politicians as they roll the vaccine out to everybody else. But this is exciting. I'm excited to be part of this. We're just putting together a declaration coming out of the Sao Paulo conference that's coming up next April. Enrique kind of sent out a SOS a little bit last week. Sounds like the healthcare system is, he said, close to collapse.
Yeah.
So,
Very bad in Brazil.
yeah. So I've been trying to draft it with him. So I'm excited to see what you're going to see to see if I need to add anything. And of
Well,
course, we'll
you've
run it
probably
past
heard it all
you later.
before, Courtney. So.
Yeah.
Yeah.
So for everybody who's come in now, we're going to get started in about 2 minutes. So we have about 30 people in right now.
Perfect. And a pleasure to meet Manvi. I don't think we've met before. Sophia, lovely to meet you.
Yeah, Dr. Howard, I haven't, but I've been following you a lot. And everywhere I go, people are like, do you know Courtney Howard? And I'm like, no, but now I do, I feel like, because I've heard you referred to me so many times. Most recently, Dr. Warren Dodd at University of Waterloo, where I am, he was like, you need to talk to Courtney. And I was like, okay, I'll get in touch. And then yeah, just nice to be introduced to you as well.
Yeah, super lovely. I'm glad you're working with Warren. He's so great. Andy, we finally published that wildfire study that we've been working on since my 7-year-old was 1. And we did publish it in BMJ Open, so it was exciting.
Yeah. So, Sophia, I wonder, did you want to, should we get started now since we've got?
Yeah.
And you would like us to turn off our cameras then while you do the land acknowledgement, is that correct?
Sure. Yeah, I was just thinking, just to make it nice and uni-focused. Yeah, so thank you so much, everyone, for joining us for today's event. To start, we're going to begin with a land acknowledgement. While we are gathering virtually today, we acknowledge that each of us is on the traditional territory of many nations across Turtle Island. We broadcast from Toronto, the traditional territory of the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. Today, it is home to many diverse First Nations, Inuit, and Métis peoples. We offer this acknowledgement as a stepping stone toward honoring the original occupants, a testimony to the oppression faced by Indigenous peoples, and our commitment to creating dialogues aimed at addressing such systematic injustice. Welcome, everyone. My name is Sophia, and I am a Students and Young Professionals member at the PEGASUS Institute. At PEGASUS, our mission is to reduce disparities, inequities, and social injustices and promote global health through the lens of peace and sustainability. We are very grateful to be able to serve our community and for the continued support of our partners. Because of their generous support, we can present this program for free. These include Wilfrid Laurier University, University of Waterloo, the Social Sciences and Humanities Research Council, and IPPNW Canada. The virtual seminar being presented today is one of many to come out of the PEGASUS conference. While our goal is primarily educational, we hope to connect people for action, including research, policy, and advocacy. For our event today, I want to encourage everyone to join the conversation. We want to make this as engaging and interactive as possible. Our presenter will be taking questions directly from our live audience. Ask your questions using the Q&A feature at the bottom of your Zoom screen. and you can highlight questions by clicking the thumb icon to ensure we get the most pressing questions. So the theme for our first presentation today is health in the net zero economy. I'm excited to welcome our guest speaker, Sir Andy Haynes. Sir Haynes was director of the London School of Hygiene and Tropical Medicine for nearly 10 years and continues to work at LSHTM as Professor of Environmental Change and Public Health. He's worked internationally, including in Nepal, Jamaica, and the United States of America, and was knighted for his services to medicine in 2005. He has published many articles on primary care research and global health issues, particularly on climate change and health. He's chaired the scientific advisory panel for the 2013 WHO World Health Report on research for universal health coverage and has led a number of Lancet series, including chairing the task force on climate change mitigation and public health. We're honored to hear from him today. Welcome, Sir Haynes.
Well, thank you so much, Sophia, for that introduction. Let me first of all just share my screen with you. Great. Can you see the first slide?
Yes.
Yes.
So what I'm going to do really is to, I'm not going to say very much about the negative effects of climate change on health. I'm going to assume that everyone accepts that we're in a climate emergency, that we need to cut emissions quickly in order to avoid very negative and catastrophic effects in the future, both to generations living now and future generations. And these effects will, of course, be mediated through a range of different pathways, ranging right from the direct effects of extreme heat, extreme weather events, through to infectious diseases, nutrition, and then through to migration and other of these diffuse effects mediated through socioeconomic systems. So that's just by way of an introduction to say, of course, I recognize that we're in a grave situation. But at the same time, we don't know that merely saying to people is catastrophic, we're all headed for doom, doesn't necessarily motivate change. In fact, it can make people retreat. It can fuel negativity, maybe even populism. And we need to inspire people, I would argue, with a vision of a world in which we all want to live, with the appropriate values, technologies, policies, to safeguard health in the face of climate and other environmental changes. So my focus today is going to be more on a positive message. What can we do about it? And I'm going to focus, well, obviously there are two broad approaches to climate change. One is adaptation. So we have to adapt. We have to become more resilient. We need more resilient health systems that can withstand climate and other shocks and build back stronger and smarter. But at the same time, we also need to reduce the environmental footprint of society very, very quickly. In fact, we need to decarbonize the economy completely by mid-century. Some people think that's too late. But we certainly need to move very, very quickly indeed. As a result of COVID, we saw CO2 emissions falling by over 7%. And that's about the level that we need to sustain year after year after year. But of course, COVID has also shown us that that's not the way to reduce greenhouse gas emissions, because it's brought with it massive disruption. Disruption to our economy, disruption to our lives. So it's a warning sign of the impacts of failing to respond quickly. And it also indicates that whilst it's possible to decarbonize rapidly, there are much more productive ways of doing so than the way that we've been experiencing over the last few months. So what can we do about climate change? Well, we can do a lot to protect ourselves, our families, and future generations. And I start off with the observation, the obvious observation from this slide, that our energy systems, our food systems, our transport systems are all dysfunctional in a way. They all damage our health in one way or another by increasing air pollution, by providing inadequate or poor quality food that doesn't sustain a nutritious diet. Our transport systems encourage sedentary living and also pollute the air that we breathe. So there's much that can be done in reorienting and reforming our sectoral systems, energy, transport, food, industry, healthcare. And these will produce near-term benefits to health, as well as the longer-term benefits of averting dangerous climate change. And the near-term benefits can result from reduced air pollution, improved food availability, and physical exercise, for example. So what is the role of the science community? Well, I think it's to identify the potential tipping points for social change, because we need transformative change. Incremental change is not going to work. We need to transform our social, technological, and economic systems. We need to have a positive discourse emphasizing the opportunities and the benefits of change. And we need to catalyze the rapid scale up, the rapid uptake of policies, technologies, and interventions. And the slide taken from a nice paper in PNAS last year illustrates really how we can move from a business as usual state through these social tipping interventions into a decarbonized state. This may come through complex changes. We may see reversals and then discontinuities, and hopefully rapid progress following some of these discontinuities. But I'm going to argue that the health message has the potential to help shift us more rapidly. It's a social tipping intervention. Capitalizing on the positive health message could be a social tipping intervention to accelerate progress towards a zero carbon economy. And one of the reasons for that is because there are many near-term adverse effects associated with our current way of living. So the energy sector, through air pollution, is responsible for about 7 million premature deaths a year from both ambient and household air pollution. In fact, the most recent estimates suggest higher numbers. Just last week or so, there was an estimate suggesting perhaps 9 million deaths from fossil fuel emissions, which is truly an extraordinary level of impact. But certainly air pollution has very major impacts on our health through increasing the risk of heart disease, stroke, some types of cancer, chronic obstructive pulmonary disease, and also, as we're beginning to understand, probably damaging our cognitive function and affecting birth weight as well. And then we have the food sector, which is dysfunctional. So we have nearly 1 billion people undernourished and over 2 billion people either overweight or obese. And that's partly due to the food system, also physical inactivity, of course, with inadequate fruit and vegetable intakes, inadequate intakes of nuts, seeds, fruits, and vegetables, for example. And all this in combination probably is responsible for about 10 or 11 million premature deaths a year, something of that order. And then the transportation sector, physical inactivity, as well as air pollution, of course. Physical inactivity is responsible probably for about 5 million premature deaths a year. And the most obvious way to improve physical inactivity is through active travel, walking and cycling. You know, gym membership, as we know, and any of you who've tried it know that it's very difficult to sustain. And really, the only way I get much physical activity is really on my bike, commuting to the office when I was going physically into the office. So, you know, that's an important opportunity. So here's the benefits of clean air. This is the WHO official figures, maybe a bit of an underestimate. And you can see that it's a major contributor, air pollution. This is particulate, mainly fine particulate air pollution, to many of these common diseases that we're trying to tackle through our healthcare delivery system. So on the one hand, we have a healthcare system, which is kind of a repair system. And on the other hand, we have an economy which produces ill health. So that's a paradox, really, that we create ill health in our economy, and then we try to address ill health through our healthcare system. And that's never going to be that efficient or effective, because we're always trying to push back on these basic fundamental driving forces for ill health. So what are the sources of air pollution? This is a paper we did a couple of years ago, led by my colleague at the Max Planck in Mainz in Germany, atmospheric chemist. They have these amazing atmospheric chemistry models, which they built up over many, many years. These are mathematical models of the atmosphere. The great thing about them is you can do thought experiments with them. So you can take out different sources of air pollution and then look at the health benefits of doing so. So this just shows you the different sources of air pollution in the US on the left and India on the right. You can see that in the US, traffic, power, agriculture, major contributors. In India, then domestic sources are very important. So a lot of solid fuels burnt in the house. Now, the Indian government is trying to address that issue by promoting LPG, which is a fossil fuel. It's more, it's cleaner, of course, than burning biomass in the home, but it's still a fossil fuel. So we need to move beyond that into renewable energy. But as a transitional fuel, it does reduce the health burdens of energy, of unclean energy. But what you'll see is also that, you know, as India develops, industry, traffic, power will become proportionately greater. So even if they're able to reduce their domestic sources, then these other sources will become more predominant. So overall then, about, according to this estimate, there's only one estimate, there are others higher, estimate I mentioned just come out in the last few weeks. We suggested about 3.6 million premature deaths a year from ambient air pollution, something of that order from fossil fuel burning alone, because there are other sources, as I've said. And you can see the map shows you where those benefits will accrue in China, India in particular, India and Pakistan, the Indian subcontinent, Europe, and to some extent Central Asia as well, and of course North America, parts of North America, which are very heavily affected by fossil fuel burning. Other parts of the world, less fossil fuels at the moment, but that's going to change in the future if we continue burning fossil fuels to drive forward development. And if you include all the human sources of air pollution, it's about 5.5. So if you include the agriculture and the domestic sources that get out into the open air and so on. So one of the problems is that our economy doesn't pay we don't pay the full economic costs of burning fossil fuels. So when we fill up our car with gas or whatever, or burn fossil fuels to heat our homes, we're not paying the full economic costs because we don't pay the externalities, what the economists tell us are externalities. That don't pay the cost of climate change, we don't pay the cost of air pollution. So according to the International Monetary Fund estimates, the energy subsidies, which they define as the gap between existing and efficient prices, including the health and environmental cost, amounts to about $5 trillion US, something of that order. And the health impacts are a large part of those costs, those, in a sense, effective subsidies. And only about less than 25% of greenhouse gas emissions are covered by carbon pricing, and it's often too low. So in other words, we're subsidizing the polluters, essentially. We're not paying the full cost of pollution or of the of climate change emissions, greenhouse gas emissions. But it's not just carbon dioxide. Carbon dioxide, of course, is long-acting greenhouse gas. About 70% of climate change due to carbon dioxide remains up in the atmosphere, about 15% of it for at least 1,000 years or more, something of that order. We don't know how to get it out of the atmosphere efficiently at the moment. But there are also these short-lived climate pollutants, much shorter lived in the atmosphere: methane, black carbon. Black carbon are those fine particles that you see as you go behind an old diesel vehicle. And those black carbon particles, if they're deposited on snow and ice, they accelerate the melting. So they heat the atmosphere, but they also accelerate the melting of the cryosphere. And then you've got, and methane, of course, comes from ruminants, from gas leaks, from rice paddies. And that doesn't damage health directly, but it's a precursor of ozone. And ozone is very damaging to health. So they all have direct or indirect effects and implications for health. And so we can also tackle these short-lived climate pollutants, and that will also avoid millions of premature deaths annually. We can't just add the effects together because there's some overlap, but it does give you an idea that there are different policies that we can take. So obviously cleaning up these dirty vehicles, cleaning up domestic energy, cleaning up these old brick kilns that produce lots of black carbon, and reducing the methane from livestock and rice paddies and so on, all help. We also know that land agricultural emissions and land emissions, land use emissions are important. This is just a slide from showing the emissions from Indonesia. In Indonesia, of course, they burn a lot of land to clear it for palm oil plantations. And this was taken from 2015, when these fires were exacerbated by the El Nino of that year, which means it's much hotter than usual. And the air pollution that was produced from forest burning and peat burning in places like Indonesia usually kills about 10,000 people a year. But in that year, it was probably killed about 100,000 across Indonesia, Malaysia, Singapore, and other parts of Southeast Asia. And at some point, it was causing more greenhouse gas emissions than the whole of the US economy for a few days. So it's a substantial source of greenhouse gas emissions. So also tackling these land use sources of emissions is really important. There's a lot we can do through urban development. Of course, about 75% of greenhouse gas emissions come from activities in cities, something of that order, and an increasing proportion of the world population live in cities. So we need to retrofit the cities that have already been developed, like London and Toronto and so on, make them much lower carbon. But the cities that are still growing, like in sub-Saharan Africa, for example, they have the opportunity to develop in a different, a low carbon trajectory, which is much more sustainable. This is just one city in Finland, Jyväskylä, which has this vision of being a zero carbon city by mid-century, focusing on renewable energy, sustainable transport, using waste as a resource. So it's part of the circular economy, no longer throwing away. They see it as an asset to be used. Healthy food produced locally where possible, recycling water, and engaging communities in a much more sustainable way through community-based activities, community gardens and other activities. We know that accelerating climate action, decarbonization, that those cities that report co-benefits of action, including on health, are more likely to undertake substantial decarbonization actions than those cities that don't recognize the benefits to health and society more broadly. This is a report from CDP in 2019, where they demonstrated that cities reporting co-benefits are 2.5 times more likely to report mitigation actions as cities that didn't report co-benefits. So there's an important role in working with city decision makers, public health professionals, and clinical and physicians more generally. Transport, and this is an experiment we did, it's a thought experiment really, we did a few years ago. We tried to envisage what it would be like if the urban population of England and Wales were to walk and cycle like the population of Copenhagen, which, as you know, has very high levels of active travel, walking and cycling. And we estimated, and these are translated into financial benefits to our health system, so that's why the numbers go up. So over time, it takes a little time for these to come in, obviously a few years, but the benefits start to accrue quite quickly in terms of reduced diabetes, benefits to the health system, reduced dementia, reduced stroke, heart disease, and some types of cancer as well, as a result of increased physical activity. There may be slight increases in the risk of physical injury, but these can be minimized by better design of separating walkers and cyclists from road traffic. And in any event, the benefits to health far, far outweigh any of the adverse effects. And even in fairly polluted cities, it's still worthwhile to walk and cycle because the benefits of physical activity are so great. Housing, many countries have obsolete housing as we do in the UK, and this is a study we did some years ago looking at the benefits of retrofitting housing. So you can see on the right side, the image shows you the thermal imaging. We can see all the heat leaking out of the walls and the windows. And the right side, the house has been modernized, and you can see there's very little heat coming out, so it's a very efficient house. And we estimated about 5,000 deaths a year in the UK could be prevented, something of that order, from reduced exposures to fine particles, to mold, to tobacco smoke, to heat, to excessive cold as well. And we could reduce the greenhouse gas emissions from the housing sector by about half, and also provide a lot of job offers, job employment opportunities as well. So major benefits, but there is a catch to this. You can't just insulate houses, you also have to make sure that the ventilation, that you have adequate ventilation as well, otherwise you increase exposure to air pollution. Other policies in cities are about increasing green space. This is an example of Barcelona. In Barcelona, they're moving towards the super blocks idea. In super blocks, they amalgamate city blocks. So these are 9 blocks, they put them together, they prevent through traffic. And they've estimated that if they could scale this up to the city of Barcelona, they could prevent large numbers of deaths through reduced air pollution, increased physical activity, provide much more access to green space for the urban population. And we know that green space exposure also brings with it a range of physical and mental health benefits. Summarized on the left side of the slide, the dark text is where there's good evidence for mental health, and particularly in adults. And the gray text is where there's emerging evidence, but further studies are needed, including for benefits in children on attention capacity, cognitive function, and so on. We still don't fully understand the mechanisms, but there does seem that there are a range of different benefits from exposure to green space. And of course, restoring ecosystems can play an essential role in regulating freshwater quality and quantity, Many major cities depend on protected areas for their fresh water. And we also know that restoring coastal wetlands and mangroves in some situations can prevent coastal flooding as well, and provide, for example, opportunities for coastal fisheries, a whole range of direct and indirect benefits to health. So a lot can be done through the effective design of nature-based solutions. Of course, badly designed ones can also have adverse effects on health. You've got to watch the growth of vector mosquitoes, for example, in wetlands and so on. But if they're well designed, they can have big benefits to health. This is a nice study looking at the provision of healthcare in Indonesia to communities in Indonesia. Rather complex slide, but what it tries to summarize from a paper in the Proceedings of the National Academy last year. It's a study which, very interesting study, which looked at the benefits of providing accessible and affordable healthcare to these populations in Indonesia that are living in areas of very high deforestation. And what they found was that the populations there were deforesting because they needed the money sometimes to pay for healthcare. So their theory of change was, if we can provide affordable healthcare for these populations, we can reduce deforestation. And that's what their paper showed. They showed that providing affordable primary care to these populations reduced catastrophic health expenditure, reduced greenhouse gas emissions because they could protect the forest, but also improved the health of the people through better healthcare, less air pollution and so on. So a very interesting study, and a very innovative study, I think. And we need more studies like that show these win-win benefits of providing affordable and accessible care. Food systems, about 30% of the world's total agricultural land is used to produce food that's never eaten. Of course, much of our food is used to feed animals. We get a lot of conversion inefficiencies doing that. And if we can just get populations in the West and in high-income countries following healthy dietary guidelines, that would reduce greenhouse gas emissions by about 10 to 15%, something of that order, according to a systematic review that was led by colleague Lucas Alexandrovitz a few years ago. Vegetarian diets, bigger benefits, not easy to achieve on a population level, but we estimate that it's possible to reduce emissions actually about 30 to 40% without going to a full vegetarian diet, just by optimizing dietary choices, reducing red meat consumption, reducing dairy, increasing fruit and vegetables, nuts and seeds, and so on. So a lot that can be done. Here's the Planetary Health Diet from the Lancet report, which came out a couple of years ago. They advocate 500 grams a day of fruit and vegetables consumption, which is probably optimal for health. They also advocate a lot of whole grain carbohydrates, low levels of consumption of dairy, about half a pint, equivalent to about half a pint of milk a day. So not ruling out dairy completely. And then moderate amounts of animal source protein, particularly from red meat, of course, which is very problematic. So their suggestions would potentially prevent about 10 to 11 million premature adult deaths a year, something of that order by 2050, if they could be scaled up to the world's population. Obviously, they'd have to be culturally tailored to different dietary patterns and so on, but I think generally quite promising. One of the challenges, of course, is making it affordable, and studies subsequently have shown that much of the world couldn't afford this kind of diet, so making them affordable is really crucial. I think I'll skip over that slide. It just really shows that we also need to take into account the fact that climate change will have negative impacts on fruit and vegetable and legume yields. So that needs to be taken into account when designing and implementing these diets. And we need to ensure that some of the solutions for climate change don't compete with food. So part of many climate change mitigation strategies is a big reliance on bioenergy. And if you put a lot of land under biofuel crops, of course, that can start to compete with food. So this is a nice systematic review of food, feed, animal feed, and fuel competition for land. And what the authors say here is that what we need to do is to prioritize food, first of all, provide enough food for the world's population. And then we can think about feedstock for animals and biofuels. So if you prioritize biofuels over these, then you could have negative health effects. So that's a really important consideration. There's also some interesting work on adaptation to climate change and how that can also impact mitigation. So this is some work my colleagues are doing on malaria and irrigation in Africa. So one of the things you have to do in places like sub-Saharan Africa is you have to irrigate the land probably, and in India as well. But in doing so, you can increase the potential for malaria to spread. And you can also increase methane if you increase rice paddies, for example. So you need to optimize these strategies to reduce malaria, reduce methane production, and also increase climate resilience. It's possible to do so, but you need to think about them in advance. And then finally, oceans. Oceans is a kind of neglected area. We don't think about much about oceans when we think about health, but ocean strategies are potentially important for mitigation. Some of them are summarized on this slide. I won't go into detail, but offshore wind, seaweed farming, renewable energy for shipping, and others, which can help to mitigate climate change, but some of them could have direct and indirect effects on health. And then in concluding, let me just talk about healthcare very, very briefly, because we're realizing now the healthcare sector is a major contributor to climate change. If it was a country, it would be about the 5th largest emitter on the planet, about 10% in the US. I don't know what it is in Canada, but Courtney will know. I expect it's close to 10%, something of that order. And we know that NHS England, for example, has committed to net zero by 2040 for direct emissions, those emissions coming directly from NHS facilities, and 2045 for indirect emissions, so the electricity that buys in, but also working with the pharmaceutical and the medical equipment sectors to decarbonize their supply chain. So procurement policies which work with these sectors to say, we will procure pharmaceuticals or vaccines or medical equipment from you, as long as you decarbonize your supply chains. If you don't, then you will not be on our preferred provider list. So that's an important incentive, I think, to decarbonize. I think I'll skip over these slides. And it was about reproductive health, but we can come to that in the questions if we have time. Just in conclusion, how climate friendly is the post-COVID stimulus? Well, unfortunately, not very. According to recent analysis by Vivid Economics, the green bars show you where the climate friendly post-COVID stimulus packages, about 12 to $15 trillion, something of that order. The red show you it's a negative contribution, and unfortunately many of them are negative. Canada is more negative than positive, according to this analysis. So more pressure needed probably on the Canadian government to try to rectify that pattern of spending. And some of the others we can't be complacent about. Even the UK, for example, is now talking about opening a coal mine, which is a crazy thing to do in the run-up to COP26. So our government also needs a good talking to. And then, so how do we need to integrate really decarbonisation into strategies for good health and well-being. Obviously SDG 3 is about universal health coverage, but many of these other SDGs around poverty, food systems, gender, water and sanitation, clean energy, urban development, and of course climate change themselves, all essential for health. So in addition to the vision of improving universal access to accessible healthcare, we also need engagement with other sectors, health in all sectors. And that's a role for clinicians and public health professionals to reach out to other sectors because they have such important impact on climate and on health. So together, we can achieve this healthy zero carbon economy. We can work together for the race to zero, which is what's being now promoted in the run-up to COP26. This is the largest ever alliance committed to achieving net zero carbon emissions by 2050, comprising 120 countries, over 1,000 businesses, 450 cities, 74 major investors, over 500 universities, hopefully the ones that you're linked with, and of course, health professionals. And we've seen health professional leadership in this area, World Medical Association, the World Organization of National Colleges of Family Doctors, and so on. So I'll stop there just to say I think it's a tremendous point in history. You know, we're in a great danger, of course, but we're also got tremendous opportunity. And we now see an unprecedented opportunity for the healthcare and the broader public health professionals to step up and become leaders, as they are, leading voices for change. And for the first time, probably in decades, perhaps in recent history, policymakers, politicians are listening to the health community. So let's make sure our voices are heard. Thank you very much.
Thank you very much, Sir Haynes, for the informative and very inspirational presentation. Our theme for our next presentation is Climate Justice, Centering Intersectionality and Decolonization, I'm excited to welcome our guest speaker, Mandy Bala, recognized as one of Canada's top 25 under 25 environmentalists and top 30.
I think you're on mute, Sophia.
Oh, thank you so much. Thank you. Thank you so much, Sir Haynes, for the very informative and inspirational presentation. Our theme for our next presentation is Climate Justice, Centering Intersectionality and Decolonization. I'm excited to welcome our guest speaker, Mandy Bala, recognized as one of Canada's top 25 under 25 environmentalists and top 30 under 30 sustainability leaders, co-founder and president of national youth-led registered nonprofit Shake Up the Establishment, which uses knowledge translation to improve literacy on the climate crisis and encourages youth to participate in political action in a non-partisan manner. Mavi is a leader in taking an intersectional approach towards addressing inequities in health and well-being for underserved groups with over 10 years of community organizing experience in areas such as gender-based violence, income inequality, poverty, sustainable agriculture, food insecurity, and health inequities. We're so honored to hear from her today. Welcome, Manvi.
Thanks so much, Sophia. And thank you so much, Andy, for the amazing presentation. I was taking notes. So I will just share my slides. Awesome. And thank you so much again to Pegasus for having me and everyone for joining. I hope I'm able to share some perspectives, particularly from the youth side. I know that was kind of the reason that one of the main reasons that I was invited, and I'm happy to occupy that space on behalf of young people, but also hopefully, you know, other intersections of identity can maybe offer some new perspectives to some of these issues that we are very impassioned to address. So how I start off normally my presentations is I welcome everybody to just listen through my positionality statement. I always start off by positioning myself. I only include the text on the screen for accessibility purposes, so you don't have to read it. Like, close your eyes if you'd like. I encourage you to take a screen break while I just read through a little bit about me in a way that positions where I'm coming from when I do speaking engagements and when I occupy space like this. So yeah, just feel free to close your eyes if you want, or just hang tight or read the screen. I reside in the geographical confines of what is currently known as Canada, on land that is home to the neutral Haudenosaunee and Anishinaabe peoples. The treaties of this land include the Haldimand Treaty and Treaty 3. I want to acknowledge with pride my ancestry as a Sikh woman from Punjab, while also acknowledging that I've grown up in what is currently Canada almost all of my life. I often reflect upon the honor of being both a woman of color and, importantly, of being someone who sees, experiences, and interacts with the world using a neurodiverse view. I see my severe ADHD diagnosis in adulthood as something that has offered me clarity towards the unique struggles that I've encountered in my life, within a world that is built not to accommodate my neurodivergence always. Moreover, I often see this intrinsic part of me as a superpower that enables me to be passion-driven, dynamic, quick, and an immensely creative intellectual. As an academic and a community organizer, I recognize the duty I have to offer representation for others that share my intersections of identity, and I find strength in using my lived experiences to inform my activism practice. I also find healing in maintaining connections to my ancestral roots. I want to acknowledge the privileges I have of both my access to post-secondary education and being able to volunteer my time to a multitude of causes. There are many voices, namely of Black, Indigenous, and South Asian peers of mine, that go unheard because they are working, living, and thriving as best they can in a world that doesn't guarantee livable wages, income, gender, or racial equity, nor social security in all forms. While I'm thankful to be given a platform, I don't intend on speaking on behalf of Black or Indigenous communities, nor communities of color in general. My only goal is to use opportunities such as these to help the cause in the best way I can, which is through the education and empowerment of others with knowledge that will allow them to become meaningful allies. I move through this space guided by the practice of centering community voices and commit to continuing my own learning alongside these efforts always. Working in the realm of advocacy for the health and well-being of all that inhabit Turtle Island, I recognize and work to engage others in the idea that we cannot fix a problem that has its roots this deep in colonization, without first decolonizing our practices as researchers, advocates, and educators. I lead by encouraging non-Indigenous allies that wish to help to actively take up less space where we can and offer more to the collective recovery of the land and its peoples, as we are all treaty peoples. And that statement, often I pause to explain, means that whether or not you're an immigrant like me or a settler, if you're an immigrant, for example, like me, you've unknowingly entered into the treaty agreements to maintain the prosperity and, the well-being of the land and all the peoples upon which you reside. So I continue to vocally and visibly support any initiatives that aid us in moving towards a collective liberation from oppressive systems. Thank you so much for listening to my little positionality statement. And yeah, now I'll kind of just dive into my presentation. So I don't have to go over this. Sophia did a wonderful job. Thank you so much for introducing me. I do have a number of affiliations, super duper, love to get involved in things, and a couple others that I'll mention that might come up later. The biggest one being that I'm currently a graduate student at the University of Waterloo in public health and health systems. My master's thesis, I'm gonna touch on a little bit later on because I just feel like it's something I just want to get the message out to the audience that we have here today about some of the work that I'm doing, as it's closely tied to the public health sector. It is on the public health sector essentially. And so it'll come up. And then the other affiliation I'm quite proud of is I'm currently the graduate president of the Interdisciplinary Center on Climate Change at University of Waterloo. And there's so many amazing things happening from that area of work. So if anyone's ever interested in connecting, just want to throw that out there. So yeah, we'll kind of dive into some definitions, some studies. Normally when I present, I like to give people like full things on screens, but again, you're never expected to read the whole thing. I just find that there are people like me who actually need content on slides, especially because I sometimes would wander when I'm watching presentations and I want to get caught up in what's happening. So please don't feel overwhelmed. You can listen to my words if that's more helpful for you as an audio learner. But the big point of this slide is to highlight environmental health and equity. And I'm sure many of you are quite familiar with the definition, but some of the components of this definition is from the Center for Environmental Health Equity that I want to point out, are related to the areas concerning policies. And so, this definition highlights that environmental health and equity is a result of insufficient and often unfair policies across multiple sectors. And something that Andy mentioned in the previous presentation was how we need, we need a climate lens in essentially every sector. And I think that as I will come to touch on a bit more in a climate focus later, still relevant also in environmental health context, to have that lens in all sectors beyond just the environmental sector. Of course, public health has a huge part to play in health inequities, and also urban planning, which I have an example on the next slide to talk about how these kind of come together. But in a nutshell, environmental health and equity, these inequities exist, and there's an undue burden of negative health outcomes on, it says here, disadvantaged or vulnerable. I would prefer to use the word structurally vulnerable, underserved communities, because these policies are meant to protect everyone and they're not serving some populations over others to a disproportionate degree. But as it ends off, these deficiencies create and reinforce health disparities. So an example that I have is just off of a 2019 study, just a quick example before we go into the many different lines of thought that I had for this study. And this study was done on Toronto neighborhoods and found that there were green spaces, of course, as we know, enhance physical and psychological health and well-being, as well as, being able to access green spaces near you, having parks, having the ability to go on walks, and the incentive to go on walks is really important towards that aspect of both physical and mental well-being. But over half of the top 20 neighborhoods with the highest pollution and decreased walkability were actually found in the Toronto context to be in the Scarborough region, which is also a very known to be a lower income and racialized region per their index of the Toronto neighborhoods. And they further found that visible minorities, in their wording, and lower socioeconomic status individuals who also self-reported lower income and education, access to education, were living in higher polluted neighborhoods. And so the reason I chose this example is because I'm in Ontario. I'm not sure where everyone in this presentation and audience is from, but this is close to home to me. And it's interesting that I grew up in one of these neighborhoods. So this really shapes, as I mentioned, those lived experiences coming into play. These were things that I was noticing growing up. And then we moved to a different demographic neighborhood, and I was noticing that there were changes. And I would like to think very deeply that my health outcomes as a result of no longer being in these neighborhoods is pretty impactful, because as I've mentioned previously with mental health and everything, green space is something that I really rely on to improve my own mental health. And I think it's important to humanize and personalize a lot of these issues that we talk about, because they're impacting human beings. So I just think about how different my life would have been if my parents hadn't been able to afford to move us out of one of the lowest income neighborhoods in Toronto growing up. So one of the last points that I want to mention on this slide is in the past definition I'd mentioned, urban planning, and that plays a big part as well in what we see in the neighborhoods. I did a report on Peel Region last year for my systems thinking course, which did really well on. And it was interesting studying Peel Region and the policies they have there. And one thing that I read again and again and again was urban sprawl. And the region is very racialized. And a lot of people there, because of urban sprawl, depend on single passenger vehicles, and that's only increasing the pollution levels. So urban planning is such an important part. And I think, again, Andy touched on this in the past presentation, but some cities have to be retrofit. And I know that was in a similar but different context, but in the same way, there's such a big part for urban planners to play with public health officials in connecting these dots between human experiences of health and the physical environment and physical and built environment that we have. So that was just kind of touching more so on health inequities, but we'll go on to see more and more of this play out. And so I think people often get hung up on the word justice. And I think, why? When there's systems of oppression, there needs to be justice, because justice centers equitable approaches towards addressing and mitigating and minimizing harm and addressing this issue and seeking equity to resolve issues. And one of the biggest systems of oppression that we are all aware of is racism. So in an environmental context, environmental racism, it perpetuates and is pervasive to environmental policymaking, enforcement of regulations, laws, the deliberate targeting of communities of color. We can say there's no deliberate targeting, but hold on. I'll show you some examples and maybe you'll change your mind. And the sanctioning of life-threatening presences of poisons, pollutants in the communities, as well as the historical exclusion of people of color from leadership. And I will touch on each and every one of these points in slides to come, and hopefully this will kind of form a bigger picture about how justice is the necessity in the public health sphere, and how public health officials and anyone really working in healthcare at all, from clinical side all the way to public health side and everywhere in between, it's important to center equity. And essentially we are advocates for health, and whatever form that may take with our professional affiliations, at the core, we are advocating for the health and well-being of all people. So I have a quick clip that I show. I don't know if I can just click it. Yeah. I'll let it play.
Nova Scotia, Canada's ocean playground. In some ways, Nova Scotia is the embodiment of what many view Canada to be, a sweet escape. But when you look beneath the surface, the picture-perfect image begins to crack.
Environmental racism is a problem. In Canada, your postal code determines your health. So we know that where you live has bearing on your well-being. Indigenous and Black communities are the ones that tend to be located near hazardous sites.
When we got here, they decided they were going to put a dump where everything went. There was body parts, there was food, animals, anything and everything.
There were concerns about the impact on the environment.
That's what our community smells like. In one view, in one instant, you'll realize why we are here.
How environmental racism has affected this community. It's killing us. This lady's husband died of cancer. All the family that lived in this house died of cancer. This man has cancer. Who knows which is our water?
The trust has been broken through several governments. Come to us!
Step back or you're going to get arrested.
You are poisoning our water.
It's just another example of their disregard for our rights.
They're doing it, and they're not even tricking us. They're just doing it now.
Canada is not a nation, it's a corporation.
And it's time for it to stop.
The bottom line is that we're sick of being sick. We hope to heal from all this.
So the reason I often show that is because it does such a good job centering the voices that I will be touching on in the case studies and examples. And I think it's important to contextualize that I'm not a member of those communities, but I hope to share their stories and amplify them. And as well, because the person who's co-producer of this documentary and also author of the original book, There's Something in the Water, is someone that I really look up to and I have the privilege of working alongside in my advocacy efforts. And that's shaped a lot of my professional and academic research and work as well as the guest lectures. I often guest lecture on this topic as well at University of Waterloo and University of Guelph. And I just always like to give a shout out to Dr. Ingrid Waldron because she really inspires me every day. And whenever she responds to my emails, I'm like, wow, she's so cool. And she's a leading authority in environmental racism in Canada. And part of the reason being because I think she's been studying this for quite a long time. So I will take you all into some examples and then show you some more of her work to center into it. And then I will move on into climate justice a bit more so that we have the opportunity to talk about that and how it relates to this. This work is the backbone of kind of what led to the climate justice movement that we're going to be focusing on later. So just a quick example I have here. In that trailer you had seen, there was vague references to different communities in Nova Scotia, particularly mentioning of the Black community in Nova Scotia. And so I found a historical example of a freakville in what is currently Halifax, Nova Scotia. And this example is pretty open shut as a case of environmental racism, in my opinion. The community there was predominantly Black, and they were deprived of access to clean water, sewage, and waste management, despite paying taxes. And that's what after 120 years of paying taxes, instead of providing proper municipal services, which is what you're paying those taxes for, the city just decided to relocate the residents because they were located in close proximity to a garbage dump. And this led to, adverse health effects. And as you can see here, this is an image from a website. The source is linked. If you're interested, you can Google it. I think this is from Amnesty's website, but this is a picture from this situation, and there were environmental hazards identified, and the city's reaction was just, let's just move everybody. But they didn't consult over 80% of them, and this forced relocation displaced residents from their homes, exacerbated economic insecurities that already existed within the communities. And the fact that they were located this close to a garbage dump, as well as they were located close to a jail, located close to industry. Just the whole situation was not very good for the health and well-being of the residents here. And the city's reaction really was not informed by the community at all. And so in relation to that historic example, this is a more present day example from Louise, who was actually the person who was driving in the car in the trailer that I showed you. And she was saying, this person has cancer, this person has cancer. So in present day Nova Scotia, in Shelburne, that's where Louise is from. And she's quoted to be saying, environmental racism is sowed into Shelburne and other communities as well through Nova Scotia. The dump was built near the Black community because they considered us less valuable, and they considered our homes less valuable than the people in the north end of town. So this is back to Dr. Ingrid Waldron. I have a quote by her, but before I read that, I wanted to highlight some of the work that she does with the Enrich Project. And the Enrich Project, I'm actually on the steering committee for it as well. And this is a map that Dr. Waldron, as part of one of the research initiatives, created. This is before I was directly involved, but I've been putting this in my slides for so long. And what you can see here is the W are waste disposal facilities, and the blue dots are Black communities. The green dots are Indigenous communities. And you can see that the close proximity to these facilities is prevalent here. And Dr. Waldron is quoted to be saying, It's not only about health and stress, it's also about lack of power. You've placed certain industries in certain communities without consulting them. You've taken away their voice. The Black communities here are much more low income than in Toronto and in other places. They experience much more oppression, have lower employment rates and educational rates. So they're the most oppressed African Black Canadian group in the country. And so this is again in reference to Nova Scotia, but what we'll actually find is, environmental racism is existent across Canada, what is currently Canada, across, globally really, but if we're focusing in a Canadian context, I'll show another example on the next slide with on Ontario, in an Ontario-based context. And what's interesting as well here is currently in Parliament, there's the third reading of the National Strategy to Redress Environmental Racism. And Dr. Waldron is actually spearheading that campaign. And I've also been a part of that campaign it's a nonpartisan bill essentially that is asking for there to be a strategy at a national federal level. So that's something you can do after this presentation if you're interested in supporting this work. So an Ontario-based example that I have, another quick one before I jump into a climate justice-based focus as well, is the Omjawaan First Nation living in what is currently Sarnia, Ontario's Chemical Valley, which accounts for 40% approximately of Canada's petrochemical industry and emits tens of millions of kilograms of air pollutants each year. This community has experienced so many adverse health impacts. One of them being actually that was really documented and kind of caught wind and in a popular sense of media was the birth ratio upset. But I've read numerous studies too recently and maybe over the years, I would say, where they've seen intergenerational impacts as a result of exposure to pollution here as well. Even on fertility between generations of mothers and daughters, and impacts on other aspects of health, particularly as well, something underrepresented being mental health, food sources, and some of those aspects that I'll touch on in my climate justice kind of slides. But so in 2019, the UN Special Rapporteur on Human Rights, hazardous substances and waste visited and was quoted to be saying, "The condition of the Omjawaan First Nation in Sarnia is deeply unsettling. People's exposures to toxins are an ongoing tragedy, a legacy of land use planning that would not be allowable today." So again, going back to the urban planning component, environmental health risk component, public health, connecting all these sectors is really the right way to address this issue. My last example, because I wanted to move away just from toxic waste facilities and proximity to hazardous pollutants, there are other forms of environmental racism and environmental injustices that impact health. And the reason I begin my presentations always off with environmental racism is because these things always exist, and climate change is only going to worsen the living conditions of so many people in so many communities across Canada. And so if you can imagine compounding these health inequities, there are so many different ways the environment will interact with someone's human experience and their health outcomes. So my last example here is, I'm going to go through it rather quickly because there's not much more to say. The drinking water advisories currently on First Nations, this was last year. There were 61 and there was a goal, March 2021, the federal government promised 5-year plan. We will end these drinking water advisories. This is what they've been saying for 5 years. And March 2021 is here. This is this year. We have actually 58 as of today in effect in 39 communities. They have fully committed to not making that goal. They've removed all goals for timeline now. And as of today's update, actually a news article posted this morning, they have a new website, which is what they're kind of saying, but they have no new money and no new deadline. This is a direct quote from the article on CBC that was published today from the federal government's kind of press release on this. So they've forgone the March 2021 goal for sure. And something that I wish I put the person who said this, I believe it was Karen Hogan. I can follow up later if people are interested, or you can screenshot and read the article. But they said, I'm very concerned and honestly disheartened that this longstanding issue is not resolved. Access to safe drinking water is a basic human necessity. I don't believe anyone would say that this is in any way an acceptable situation in Canada in 2021. And something that I say is if this happened in Waterloo, where I'm currently living, I don't think that it would take this many years. Personally, I think they would, this would come back to that comment that Louise made earlier about the value of human life and, human health really. So climate justice, climate justice takes a human-centered approach towards addressing social, ecological, and economic issues that will only be exacerbated by the climate crisis. I think people use climate change and climate action as words, but those words are really associated with the numbers, the emissions, very valid concerns, very much in need of studying and focusing as well. But I think that the only thing that those metrics fail to encompass is the human experience, as well as maybe they're not the best at holistically encompassing that. So this is the approach that's chosen to utilize equity-focused advocacy practices, whether it be in the voluntary sector or whether it be in academia, to ensure a livable and equitable and a sustainable future for all, given that we know that the impacts of the climate crisis and environmental degradation have not and will not be borne equally across all populations. And one example that I like to give that isn't mentioned on the Center for Health Equity's website is, for example, thinking about how in US and Canada, studies have found that for homelessness in youth, LGBTQ two-spirit plus individuals have a higher percentage of homelessness, and it's remarkably higher. And so if these youth who already are facing and experiencing the world with systems of oppression and discrimination are also disproportionately homeless or houseless, they're also increasingly vulnerable to, for example, if they're living in an urban setting, the urban heat effect, the pavement's going to feel like 75 degrees Celsius. Access to so many amenities that are necessary for health and well-being. We have to take a climate justice approach to address this issue because we're cognizant then of the social determinants of health and the variety of social, ecological, and economic factors that are coming into play with the climate crisis. So being aware of the emissions, but also being aware of downstream, the impact on humans and really centering that human impact. So I'll take you into one quick example with women, and then I'm going to jump into what we can do. And hopefully I'm not over time because I'm trying to run through all the things. But, here it's written, women are disproportionately impacted by climate change, impacts such as droughts, floods, and other extreme weather events. They also have to be a critical role in combating climate change, but need to be better represented at all levels of decision making. And my thesis really looks into public health decision makers and perception of risk and how that informs policymaking. And I'll kind of take you into those slides in a bit. I actually might skip this example just for time purposes, or maybe I'll go through it really quickly. But this is one of a bajillion examples that I could have chosen. I just have this one because I have the slide on women right before it. I think I will skip the majority of it, but what I want to highlight here is, for example, there's so many different ways that climate change's impacts will be borne differently across different populations. In the context of, for example, Indigenous women, in particular here, Inuit women, there was an exploratory study that did a gender-based analysis of food insecurity of Inuit women in Nunavut and found that 64% of the participants had experienced food insecurity in the past year, with 80%, so a disproportionate degree of them being women. And a lot of this food insecurity can be rooted back in their work to be related to climate change, because with melting sea ice, traditional food sources are at risk, as well as, transition to Western diets being expensive and not nutritionally sound. If you've never been eating this diet, if this isn't the diet that you're familiar with, and this is something that's changing in your human physiology and your, just your nutritional soundness with this diet being rich sources of, I said the word nutrition 3 times now, but nutrition, it's not for you, and it's not optimized for you in that way. And maybe with increased literacy and access, it can be, but that switch being so sudden and not being something that you chose to do, rather it being a product of the changing environment around you, is contributing essentially to these health inequities. So here I want to touch on something related to my thesis. And I specifically brought this slide in because I know the audience here is in the healthcare, is in public health, and is generally interested with these things. And so my thesis is really focusing in on perception of climate health risk and really how it informs policies in Ontario. But I do work at the provincial and federal level as well, just because, these systems are interconnected. So quick facts, 50% of Canadians believe climate change poses a risk to their health now or within 10 years. As of 2016, in 2018, this number rose to 65% for health risks specifically due to rising temperatures. And it's interesting how wording even has an impact between rising temperatures and between climate change, because people have their own associations with the word climate change as well. And despite scientific consensus on climate change being, anthropogenic climate change, only 60% feel the Earth is actually getting warmer, partly or mostly due to human activities, which highlights, in the literature I've read quite a few times, it's highlighting the need to understand the efficacy of health risk communication and how individuals are understanding the climate crisis. Notably, what's interesting to me and my work, taking in the intersectional component, is that white conservative males, particularly those who self-report higher understanding of global warming, contribute to a high level of climate denial, even when they're controlling for the effects of political ideology. And then you wonder, why? So it's interesting because intersectionality has a part to play in everyone's lived experiences, and perception of risk is a part of those affective emotions that influences your decision making and the way that you function in the world, and in your professional roles. So what's interesting here is that there was a study in America, and it was like the huge. It was like less than 95%, honestly. I don't remember the exact number, but it was in the high 90s of people of color were at the CEO level of any NGO, environmental, public health authority position, many different areas of leverage for this issue. There was very low representation, and it was overwhelmingly male. I think Megan Leslie was like the only female woman CEO represented at the time of the study and stuff. So I don't know in a Canadian context, but one way to mitigate this is to increase diversity and representation in environmental governance at all levels. And this is because the perceived risk of climate change as a public health threat has been associated with race and gender. And a couple studies here that are US-based found that in their wording, Hispanics, Latinos, and African Americans are more likely to be alarmed or concerned than white individuals, who are more likely to be doubtful or dismissive. And this is also seen with, like how likely you are to be intrinsically motivated to be an advocate for this issue. And I think that also comes into play with different, risk perception is based on, again, your lived experiences. If you've never encountered or conceptualized this being as a direct hazard to your health, it speaks to a degree of privilege, right? The world that we're currently living in with the settler colonial government, all of our premiers are white men. Well, not right now, but at the time that I wrote this, originally when I've been starting my work, and now majority of them are. So it doesn't really change much of the argument, but it's interesting to think, risk perception, how that's informing the policies that we're making and really the direction we're taking in our future. So this is a quote by ecofeminist Vandana Shiva, but we are either going to have a future where women lead the way to make peace with the earth, or we're not going to have a human future at all. And of course, with women, I hope people are taking the intersectional meaning of this, and not just women, but women of color, Indigenous women, Black women. I'll leave you off with a couple things. I'm going to skip this slide, but I can speak to this if people are interested in the Q&A or anytime. But I want to highlight that climate change is an interdisciplinary, multi-system issue. I know Sir Andy touched on this already, so again, maybe I'll skip this, because this is the slide that I really want to leave people on. I think some actionable things people can do to center justice in their everyday advocacy work, whether it's in academia research, whether it's in clinical care, wherever it is these 4 things I think are really important to me personally, and I recommend them to young people, to old people, to anybody, professionals, academics. The first thing is to know your positionality, and I started off this presentation with that because there's strength and vulnerability, but also you see your limitations of experience, and I hope I highlighted that with the perception of risk. A lot of people are white, and that's okay. My best friends are white. They're advocates, they're allies, but knowing your limitation allows you to create space for other people's views. And I think that's increasingly becoming something that people are becoming aware of as necessary for the future that we want to manifest, an equitable, sustainable future. So by knowing it, you become aware of it, and you don't ignore it anymore. I think that's really fundamental towards the work of decolonizing, but we'll get there. Seeking opportunities to learn always, doing your research, but being open to learning and welcoming horizontal learning opportunities with peers. And in some cases, maybe not mentors, but but peers, peer-based learning is incredibly important because you're centering those lived experiences. If you have a friend who has lived experiences like mine, my childhood growing up in one of the lowest income neighborhoods in Toronto, my experiences in my worldview is going to differ than yours. So there might be opportunities to learn, but I also have opportunities to learn from my peers that are from different intersections of identity. And this can be in a casual conversation. So just keeping your ears and heart open is really important. Decolonizing your worldview. And I'm going to have one more slide after this that I really want to touch on about what that means in practice. People don't know what that means, they say it and they don't mean it. And I think that's really fundamental to the work here. But reprioritizing lived experience is a valid source of information. RCTs, we've all seen the pyramid, but that fails to acknowledge so much below about the human experience. And finding your inner voice, grounding your actions in your values and experiences. That's what I do. And I find it to be a really beneficial practice because academia doesn't do that enough, I think, and research doesn't do it enough. So last 2 slides that I have, I promise, and I'm so sorry if I went over time. What decolonizing actually looks like. This is one of the many ways you can do it, but one thing that I think is important is to just function in the space by acknowledging and realizing that institutional academia and the westernized discipline of science wants you to exclusively view RCTs as fact. I come from a clinical immunology, translational medicine. I worked at the Hospital of Sick Children research background before public health. This is my experience too, and I'm not negating RCTs. I would not be vaccinated today. I just got the first dose, would not be vaccinated if we didn't have RCTs. Don't fail to acknowledge that. But I think we can be nuanced enough to hold the ideas that is fact, but there are also other forms of evidence. So I often use the word evidence informed because I think science has this connotation that we're negating all other forms of knowledge and knowledge structures, and traditional knowledge, for example, indigenous led biodiversity efforts, conservation efforts have higher levels of biodiversity. Now scientific articles are backing that, but that's been the thing since time immemorial. So just because science doesn't validate it doesn't mean that it's not fact. And I think that we can be nuanced in our understanding of this work essentially. So and also I'll mention here, it says here depersonalization is a component. Qualitative work has the ability, and participatory research has the ability to really enrich the work that you're doing. And I think that that's really important because you don't want to erase the historical, sociocultural, political, and environmental dimensions of the human experience. Promise, last slide. Colonial time, I think this is one that really, this is going to be like a whole thing to unpack. So I'm just going to read the quote. And I encourage you as we wind down to close your eyes again if you want to take a break, because there was a lot of talking. But I'm going to read the quote from Deskiran Dillon, an ally like myself, who worked in this area of work with Indigenous resistance and worked alongside communities for years and came to this work recently. This was published last week, actually, or 2 weeks ago. Colonial time has distorted the temporal boundaries of ecological devastation and is distinct from the sense of time experienced by Indigenous peoples who have had to survive environmental catastrophe since the initiation of the colonial project. From the vantage point of Indigenous resistance, the environmental crisis aligns with the time of colonization. Resistance efforts to halt the contamination and toxicity from industrial projects then must be simultaneously linked to a long-term strategy advancing Indigenous freedom and the resurgence of Indigenous governance systems that demand a different understanding of time and its relationality to the land, water, and air. And so I'll kind of end off on this idea that, colonization is really synonymous with, in the Western context, in the Western world, I say with quotes, with progress. We think of like industrialization as progress, and that is tied intrinsically to colonization of this land, commodification of the land, all the things that came with it. So climate change is inherently linked to this issue. So you really can't have one without the other. And I think the temporal context is really important in the work that you're doing, not erasing that in the work that you're doing is fundamental towards decolonizing. So yeah, little plug for my work, Shake Up the Estab, visit our website, evidence-informed, community-centered, like everything I do. And yeah, let's connect. That's kind of all I have to say. So I apologize if I went over time. I have no idea, but that's it for me.
Perfect. We'll get Courtney to come on and help moderate the questions.
Hi, that was so much fun. I so enjoy hearing from both of you. I've heard Andy present many times. Manvi, that was my first time hearing you, but You know, what an almost perfect pair you are to be giving us such rich context to this moment in time. There's a couple of questions in the chat that we can launch forward into. So Mary Louise McAllister, this was for Andy asked, what strategies do you use to publicly promote the health benefits of addressing climate change? How do you get these issues on political public agendas?
Well, thanks. Yeah, it's a great question. I mean, the fact of the matter is we haven't been tremendously successful, I would say, in the past, but I think the dynamic is shifting, you know, particularly with COVID and so on. So we are seeing a new receptivity, which wasn't there a few years ago. But the kind of approaches we take, well, first of all, to engage a range of sectors, because many sectoral decision makers don't realize that they're actually health decision makers. So when you point out to them that they will probably, that they can prevent as many premature deaths probably as many healthcare professionals can, that's a new message for them. They don't really haven't grasped that before.
Mm-hmm.
Approach is to we don't necessarily just work with national level decision makers, because sometimes that can be more difficult to make progress at that level. So I also mentioned some of the work with cities, for example. So a lot of the very dynamic work now is occurring at the city level. And you see a lot of mayors and other subnational decision makers really committed to acting on climate change. And so working with them can be quite rewarding, but you have to start from where they are. So for example, we've been doing some work, my colleagues have been doing some work in Kenya with Kisumu, which is a quite large city in Kenya, very rapidly growing. So, you know, I think we went in with sort of various concepts of what we wanted to see, but then we had to ask the local people, well, what is it, the problems from your perspective? Because the problems from their perspective were things like waste disposal, waste burning, you know, which we hadn't fully taken into account. So we had to completely shift our strategy around. When you start talking to local people, it starts to become then a matter of co-designing solutions. It's not outsiders coming in and telling people what to do. It's about co-designing, co-creating solutions, you know, with some technical support. That's it seems to me is really the way of the future. It's about co-design and co-creation. So yeah, I think lots of activity happening right now, and certainly much better place than we were, I think, a few years ago.
Yeah, that I agree. I was happy to see you present. I think it was Health and Harmony's work with the forestry and healthcare. Yeah, and that's very much Dr. Kinnery Webb's message is the radical listening. So she says for her, the big step is to go into the community essentially before you've written your grant proposal, because she says that once you write the grant, you've had to sort of say what you're going to do. So she says what we did was we went to, I think it was about 20 Indigenous communities around Gunung Palung National Park. I'm on their board, and so I actually visited the site. And yeah, so they have 20 forest guardians, one in each community. But the question they asked at all sorts of community meetings was, if the international community could give you a gift for you to protect this rainforest, which is a resource for all of us, what would it be? And they said, well, healthcare and alternative jobs. And so it was actually one of the most, they actually had a Goats for Widows program. So they also provided alternative livelihoods, that they trained people in farming, et cetera. And so I thought that that was really such a wonderful way of marrying some technical skill to the actual needs of the community, and demonstrating an element of climate justice that I think sometimes we haven't done a great job of bringing to life between the global north and the global south. Yeah, so interesting. So both of you talked in different ways in your presentations about power. So this question to Sir Haynes was really about, you know, how do we go about influencing power? And Manvi, you quoted, I think it was Ingrid Waldron at one point, where she said, really the bottom line is this is all about power. And so I'm curious if you could both tell me in your current projects, how you're really going about influencing that intersection, what your current sort of theory of change is with regards to that. Do you want to go first, Manvi?
Sure, yeah, I just didn't know what order we were going to go in. I would say, so there's a couple things. one being in the voluntary sector, which I think is, we don't like see it as, maybe like sometimes we do see it as really important, sometimes we don't. I think it's really important because I think the work complements the work that's happening in the academic side, and I do work in both related to this. But in the voluntary sector, a lot of that is at its core amplifying Indigenous land defense efforts. I think that it's like redistributing power, and one way you can do that is in a capitalist society, time is money. Like we always joke about that, but it's true. Like volunteering, investing time into people and organizations and efforts, and investing real money as well. Whatever you can do to invest in the amplification of existing efforts by Indigenous communities is really important, especially for self-determination and sovereignty, and supporting those efforts because they go synonymous with progress, in my view, towards climate justice. And in the academic sphere and like research and whatnot, the work that I do is with decision makers. So it's actually really interesting that I'm doing my master's thesis is, as I mentioned, on that perception of risk and how individuals' identities are and their affective emotions and, just them as a whole human being, encompassing every part of them, is informing their professional role as a decision maker. And my definition of decision maker in public health isn't just public health officials, it's multi-sectoral. So it includes the urban planners and the other people that I've kind of highlighted on. And yeah, I think that the best way to do that is I just straight up asked them in my interview guide, I'm like, hi, so, who is involved in your local strategy plan making? Like, let's get like more research out on who's at the table making these decisions and why are you making these decisions? Where is your, what are your motivators? What are your authorities? What is your knowledge structures? I'm doing a component in my thesis that maps knowledge structures, and it would just be really interesting to even see how these differ amongst different populations. And that's kind of the work that I'm doing, is really cognizant and not erasing of identities within the sphere of representation at the decision-making table, because of some of the literature I showed concerning even just perception of risk at its very core. People are not as concerned, they're less likely to act on it. So looking into that. So some of the work I do is, all of the work that I do is really rooted in representation being a fundamental component.
Mhm.
Yeah, well, I mean, I would just say that power is, of course, at the center of this. And if you want to implement change, you either have to ensure that some of the power is shifted towards those who will implement change, or change the mindsets of some of those people in power, or both. And probably it has to be a bit of both. So there are some people in power that you'll never change because they're actually completely rooted in the old way of thinking. They're only going to make their money out of fossil fuels. They're never going to change. So that waste of time, to be honest. There's no point wasting your time with them. But there are others who are minded. They could be persuaded to change. They do have some concerns about the future. They do see that the current business model, if you're talking about the private sector, is not sustainable. And they do see that if they're a political decision maker, they also see that there may be votes in working in a different way. So those people we can work with. And I think that the health sector is fortunate in a way because it is quite used to talking to people from a whole range of backgrounds. Many of us have worked in very disadvantaged, marginalized communities, but at the same time, we've also interacted with people who are very influential. So health workers are often not particularly fazed by whether someone, what their kind of socioeconomic status is, because you've interacted with people from a whole range of different backgrounds. And I think that gives you a bit of an edge in a way than some other professions in speaking truth to power where that needs to be done. And it does have to be done quite often, actually. So I think the other thing that we're probably not very good at doing, but we need to get better at doing is working much more with media and communications. And I really liked the film that Manvi showed. I thought that was really powerful. And working with filmmakers and others who understand much better than we do about how to communicate to the broader public and also to the power structures is really important. So for example, there's something called the Global Health Film Festival, which I've been a great honor for me to be associated with some years, but they work young filmmakers who put together marvelous documentaries, very impactful sort of films, documentaries, non-fiction, sometimes fiction as well, which exemplify, some of these issues around planetary health. And I think working with those who can communicate much better than we can is fantastic. And it's really a creative way of interacting with people. And also, I think, does give us another angle to influencing the kind of power structures that we have to try to influence and work with where we can.
Yeah, I've been thinking a lot about this lately because it feels like such an important moment to communicate the linkages between human health and the health of the rest of the natural worlds, because we have these big healthy recovery budgets coming out. And we know that probably after that, the cupboard may run bare. And meanwhile, we're talking a lot about health messengers, but all the health messengers are exhausted because they're in the ICU. And so I think really this year in particular, if we can dedicate some substantial resources of time and money to forming those relationships with professional communicators to make that message even while people are on call, I think that may be very important. There's some other questions in the chat, but just to round it out, because we've only got about 4 minutes, I'd like to know what you're each both excited about right now. Like what when you wake up in the morning, are you like, yeah, I'm gonna keep going, I'm gonna do this. What is it that you're really excited about right now?
Nambi, why don't you go first?
Okay, I was gonna make you go first.
No, you go, you go.
Okay. I think something that really excites me, honestly, is young people. I am a young person, and I know that. I often feel a lot of imposter syndrome in spaces like this because I'm working on it, but it's because I think that young people haven't really been seen as any sort of authority on anything. But something that I love about working in a space with only young people, in multiple spaces, in both my nonprofits, it's just young people. Reason being because we recognize this as a more urgent future situation for us. Like, I know a lot of young people have also taken pledges to like not have children until it's sustainable to do so, and I think that that's kind of alarming to people sometimes when they hear it. But I think it just shows you the gravity to which people are thinking about this issue and concerned about this issue. So I think if you're ever looking for hope, I think look to the young people. We're really centering our future. It's kind of an imperative decision. Like we don't really have a choice, but I think that also centers a lot of hope. And I think, yeah, go and check up the USAV's website. You check out the 30 young people that are working with me every day. You know, it's hard not to feel good, like we're doing something, even if it just means that we're engaging in local messaging and community-based care. You know what? It's making the world a little bit better. So it makes me feel like good every day to be able to work with people that are young, that I know are going to be around. They're going to care about this issue. And it really helps me like think about how we're making it the future that we want. We're getting engaged in politics. We're getting engaged in everyday decision making, really. Whether it's like Andy touched on with the, diets, everyone I know is vegetarian. I know that it's difficult to make that switch or whatever, but I did it 3 years ago and I honestly never looked back, and it made me feel so much better. So little things like that, not everyone can do them, but if you can do some version of it, it's all good. Everything really helps. And it's a collectivist approach, really, that makes me feel, I don't know, gives me hope. So that I'm excited about. And on a health level, I'm feeling a little more hopeful about the pandemic. So I don't know, you can't really ignore that. It's like the elephant in the room. So that's me.
Yeah, that makes sense. That makes sense. And Professor Sir Andy Haynes, who has been
Well, I mean, let me fully endorse what Matt says. Yeah, I mean, I think for people like myself who've been talking about this for too long, it's so great to see so many enthusiastic and knowledgeable younger colleagues coming along, and it's really given us, I think, a tremendous boost and a tremendous feeling of optimism about the future. So that is potentially really transformative, I think. And just one quick thing is that what I'm working on at the moment is something called the Pathfinder Initiative, which is with Helen Clark and with Joy Fumafi, my colleagues who are co-chairing it with me. And what we're trying to do is to collect lessons from the implementation of zero carbon policies, strategies, technologies, interventions, whatever you want to call it. So we're actually trying to capitalize on the knowledge that's been generated by people who are trying to make a difference. We want to share, obviously, successes, but failures too. It's important we learn from failure. There's nothing dishonorable about failure if you've been trying to do something, and it's often very complex to make change happen. So what we're doing is really trying to capitalize on those lessons from on-the-ground experiences by individuals, communities, decision makers, and so on. And hopefully, I think we're going to collect quite a lot of interesting examples, and we're going to build up a whole library of case studies, which obviously will be openly shared with everyone. So that's, I think, also gives us some grounds for optimism and focusing on the positive rather than on the impending crisis we all know is around the corner. But hey, let's head it off. Let's stop. Yeah.
Well, both of you have given us, I think, a lot of reason to be hopeful and optimistic. So thank you so much for sharing your wisdom and your energy with us. And thanks for hosting us, Neil.
Yeah, thanks, Neil. Thanks to you.
Well, yeah, I wanted to thank everybody and to also just give some details about what we're going to be doing in the future. I think that these presentations end up being linked. Manvi, we actually had Ingrid Waldron as our first speaker in the fall. And now as we think about other talks, we're going to have other things on environmental toxins and lower socioeconomic status. Another thing on people of color and the police. So many of these issues are quite linked, and the issues of the global north and south. The most immediate presentations that we'll have on the 19th, we'll do something in conjunction with the University of San Francisco de Quito in Ecuador, with me and Isildine Abu Alish, talking about COVID and communities that are out groups. So the in-group, out group. And then in April, we'll have a couple of presentations, one related to refugees and migrants. That'll be in French, and actually another one in French on lessons from the Ebola crisis in Congo. So we'll have Congolese colleagues leading that. So we're really expanding as an institute. The video for this will be on PegasusInstitute.org. It's very different than PegasusInstitute.com. So make sure you get to the right website. I really want to thank each of our speakers. So Sophia has come back to Pegasus that she was involved with organizing before, and she's teaching about many environmental issues. Courtney coming back after having presented a couple of months ago to moderate, and we really appreciate having you back, Courtney. So we get people who are participants who become presenters, people who are presenters who become participants in our institute as we become parts of communities. And today I especially want to thank Manvi, who came in at the last minute and prepared a wonderful presentation. So we really appreciate that. And yes, the youth represented by you really represent a great future for us. And Andy, I'll just say something that might be a bit sexist, but here you are, our knight who's rescuing our damsel planet in distress. So we really appreciate your coming and being so generous with your time and always flexible. And so it's nice to have you as part of our community. It looks like a beautiful day out, and I think that you guys have inspired us for a different future post-COVID. And so thank you all. Bye for now.
Thank you, everyone.